Hi, my name is Paul Heppelston. Anyone who's been in one of my classrooms or come to any of the Mr. H Presents events over the years knows that music is pretty important to me. What do I add to that, really? Music is important. I think that it makes life sweet, and I think it helps us get through times where life is not sweet. And the great thing about it is it can be effective without always knowing exactly why. There's a quote that I love to use. It's after silence, that which comes nearest to expressing the inexpressible is music. And it just speaks to the power of music to operate in ways that we don't necessarily understand, but lots of ways that we can be grateful for anyways. So I wanted to take a minute to talk about the music therapy program at the Janeway and why I think it's important, why I think it deserves our support, and of course just express appreciation for for Susan Quinn and the work that she does. One of the things that I found when I talked to a number of different parents about their experience with their children in music therapy is that it doesn't feel like therapy. The music therapy sessions are the sessions that the kids who are maybe seeing physiotherapists or occupational therapists or speech language pathologists, the music therapy ones are the ones that they don't miss, right? And the great thing is that it's still just as therapeutic as the others. Music therapy treats more holistically than the others. The physiotherapy will treat sort of muscles and things like that, and affect movement, and but it doesn't. Physiotherapy doesn't necessarily get to the ears, get to language, get to heart or mind. Music does all those things. When Susan comes in to do a session with Stella, she could be coming in to do everything from movement exercises, bringing in a drum and a mallet, and helping Stella to work on her fine motor skills, to bang drums, to shake shakers and things like that. She could be coming in to write a song with Stella, and which they just finished actually this week. They created a song. Susan helped Stella create a song by giving Stella choices to make, and so this piece that they wrote, it's lovely, and it's very much Stella's creation, as facilitated by Susan. Sorry, for those who don't know, my 7-year-old daughter Stella is recovering from a surgery on her brain last fall that's left her temporarily unable to walk and to talk, and her fine motor skills have been affected. And while we wait for that to resolve, she sees a number of different therapists. Susan is one of them, and I just love what she does. Sometimes Susan comes in, and Stella, between her other appointments and between chemotherapy treatments, she's just not up for actively participating, but we'll certainly listen to Susan as she plays some soothing music on guitar or on flute, and it makes a big deal in our lives, particularly as we're waiting for Stella's words to come back, and for Stella's neural injuries to resolve. Music ends up being for her, not just an expression from where she's at, but also I think that it reaches her in ways that language doesn't. There's lots written, and there's lots that I've read about the ways that brains can process music more easily and more readily than language, particularly brains in recovery from injury. And this shouldn't surprise anyone who's ever seen a baby respond to music. I think that there is something in us that just is geared towards melody and towards harmony and towards rhythm, and it's for all of these reasons that I'm so grateful for what Susan does And I just feel like the music therapy for Stella's recovery is right up there with physiotherapy and occupational therapy and speech language, and so we've got lots of love for Susan and her program in our house, and I just really appreciate everybody coming out to support this fine lady and what she does, and many thanks to all those involved with making this show happen. Thanks for listening.